Good morning, I'm Gabrielle Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of assessing and performing oral care for my client. This is to ensure and maintain the cleanliness of the mouth and teeth of my client. So, I am your nurse for today. I'm Gabrielle Baliton. What is your name?
Please enroll.
Is it okay with you if I'm going to perform an oral care for your teeth to be maintained clean?
Yes.
So first, I will perform hand hygiene and provide client privacy like closing the doors and windows to ensure the comfortness of my client. I will now prepare for the equipment needed like the basin, the cup of water, toothbrush, and toothpick. I already assist my patient in a sitting position for the oral care to begin. In preparation, I will first make sure the self-care abilities of my client and assist her usual mouth care practices. And then now I will inspect the lips, gums, oral mucosa, and the tongue for deviation from normal. And then after that, I will already check if there are presence of oral problems such as gingivitis, halitosis, and some loose or broken teeth. The first thing that I need to do is to put a gloves to prevent the virus from spreading and put a clean towel under the chin of my patient. After that, I already wash her toothbrush and then I will now put the toothpaste in it. Now I'm going to brush the teeth of my patient. It is needed to hold the brittle at a 45-degree angle and move it up and down and gently stroke the teeth. After that, I'm going to brush the teeth up and down until I've gone through the inner surface and to the outer surface of the teeth. So now, after brushing the inner and the outer surface of the teeth, I will now ask my patient to expose her tongue to brush using the toothbrush. Then now I'm going to ask my patient to add the cup of water to spit the water and access the dentifrice into her mouth. And then now I'm going to ask the patient to repeat the procedure of spitting the water to be free from any food particles. Then now I'm going to floss the teeth of my patient. I'm going to wrap the floss around my third finger and using my thumb and index finger, I'm going to stretch it and gently floss the teeth up and down. And then it moves to the gums. Um, let the floss away from the gums and move it from up and down motion. Then now I'm going to ask my patient to hand a cup of water to free from any food particles coming from the teeth. Then now I'm done with the procedures in oral care. I'm now going to clean the basin and I will now discard the gloves that I used and perform hand hygiene again and document all the procedures I've done. And now I'm Gabrielle Baliton. Morning, I'm Gabrielle Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of assessing the patient with artificial dentures. First, I will apply Erdan gloves if the client cannot remove the dentures. I will assist them by taking a tissue or gauze. I will grasp the upper plate at the front teeth with the thumb and second finger. And then I will move the denture up and down slightly. Lower the upper plate, move it out of the mouth, and place it in the denture container. Then I will lift the lower plate, turning it so that the left side, for example, is slightly lower than the right. To remove the plate from the mouth without stretching the lips, and then I will place the lower plate in the denture container. After that, I will remove a partial denture by exerting a equal pressure on the border of each side of the denture, not on the clasp, which can bend or break. Then after that, I will clean the denture by putting it in a sink. And then I will be careful not to drop the dentures. I will put or place a washcloth in the bowl of the sink. Then move on to the inspection of dentures and the mouth. I will first observe the dentures for any rough, sharp or worn areas that could irritate the tongue or the mucous membranes of the mouth. Then after that, I will assess the fit of the dentures, lips and gums. Then moving into the inspection of mouth for any redness, irritated areas, or indications of infection. After that, I will return the dentures to the mouth. I will offer to the client some mouthwash and a curved basin to rinse the mouth. If the client cannot insert the dentures independently, and I will insert the plates one at a time. Then I will make sure to hold each plate at a slight angle while inserting it to avoid injuring the lips. The most important is I will assist the client as needed as much as the client's hand and mouth with the towel. Then I will remove and discard the gloves. And then now I am done with the procedure of assessing the patient with artificial dentures. I need to perform again hand hygiene and document all the procedures I've done. Again, I'm Gabrielle Baliton. Thank you.